Meeting to order. Welcome to meeting number 98 of the House of Commons Standing Committee on Health. Today's meeting is taking place in a hybrid format pursuant to the standing orders. In accordance with our routine motion, I'm informing the committee that all remote participants have completed the required connection tests in advance of the meeting. Pursuant to Standing Order 108, Sub 2, and the motion adopted on November 8, 2023, the committee is resuming its study of the opioid epidemic and toxic drug crisis in Canada. We are joined today for the first hour of the meeting by the Minister of Mental Health and Addictions, the Honourable Yara Saks. Welcome, Minister. Accompanying the Minister, we have officials who will remain for the full meeting from the Canadian Institutes of Health Research, Dr. Samuel Weiss, Scientific Director, Institute of Neurosciences, Mental Health and Addiction. From the Department of Health, Dr. Stephen Lucas, Deputy Minister, Eric Costin, Associate Deputy Minister, Jennifer Saks, Associate Assistant Deputy Minister, Control Substances and Cannabis Branch, and from the Public Health Agency of Canada, Dr. Teresa Tam, Chief Public Health Officer of Canada, and Nancy Hamzaoui, Executive Vice President. Thank you all for taking the time to appear today. Minister Saks, you have the floor for the next 5 minutes. Welcome.
Thank you, Mr. Chair, and thank you, honourable members, for inviting me here today to share what will be a fulsome discussion in this study. I'm pleased to be here and contribute to your important study on the toxic illegal drug and overdose crisis. This crisis is so widespread that no family, indeed no Canadian, is untouched by it. I expect you have heard from families, frontline workers, researchers, health, and other experts of the tremendous toll the crisis is taking across Canada. Many dedicated people and organizations are working tirelessly and relentlessly to provide a range of much-needed supports to some of the most vulnerable and marginalized people in our country. They are saving lives, providing hope, and helping people find their paths toward well-being and health. These are the tireless heroes of the crisis who show up in the most challenging of circumstances. They deserve nothing short of our complete support and gratitude. I have been fortunate enough to meet with many of them across the country. Their stories and dedication inspire me and so many others in their communities. They've shared with me that the deep polarization and misinformation that has colored the debate in Canada regarding this crisis is not helping them. In fact, it is making their challenging work that much harder. I've pledged to them that I will work to amplify their voices and share their good work. We must not forget that everyone working in this field and everyone around this table shares the same singular goal. We are here to save lives. To that end, our government has put compassion and dignity at the center of our comprehensive strategy to address the harms of this crisis. We are investing in a continuum of supports from education and prevention through the expanded access to quality treatment, aftercare, and recovery services. Prevention and treatment are two ends of the spectrum, but we must also care for the lives of people who are struggling in between those spaces. The reality is we must provide necessary resources to people who use drugs to minimize the risk as much as possible while they are on the path towards recovery. We are tracking our public health interventions, and we can see where they are working. Across supervised consumption sites, the number of overdose responses attended to between October 2017 and September 2023 is over 52,000. Additionally, more than 260,000 referrals were made to connect people with health and social services to help them towards recovery. It is abundantly clear that no single intervention will turn the tide, and it will take the collective efforts of everyone. As you will be aware, our government has made historic investments to provinces and territories to increase access to mental health and substance use services. Colleagues, we need to make mental health and substance use care a full and equal part of our universal healthcare system. In support of our shared efforts, I've convened an FPT table with Ministers of Mental Health and Addictions that meets quarterly to collaborate on these important priorities. Additionally, I'm working closely with my Cabinet colleagues to address health and social factors that can impact an individual's risk of substance use-related harms. For example, I'm working with Minister Hajdu to advance work towards reconciliation and support Indigenous peoples to develop distinctions-based solutions to address the impacts of this crisis. Alongside Minister Fraser, we are focused on improving access to supportive housing. which is one of the most important things needed to help someone to stabilize their life and to find their path to recovery. I'm also working with Minister LeBlanc to address public safety and the role of organized crime in the production, diversion, and trafficking of toxic illegal drugs. We have a whole of government strategy. This is the Canada model. We are confident that working together with a comprehensive response, we can make progress on this critically important priority. Merci, thank you, and I look forward to your questions.
Thank you, Minister. We're going to start with questions now, beginning with the Conservatives for 6 minutes. Dr. Ellis, please.
Thanks, Chair, and thanks, Minister, for being here. You know, one of the things we say in medicine is primum non nocere, above all, do no harm. Perhaps you could table, actually not perhaps, we'd like you to table the data from which your government draws its information to tell us and Canadians when you're going to end this dangerous experiment.
I thank the member for his question. As he's aware, and I'm happy to table here, all data of our programs and the evidence that we have collected from our SUAP projects and other interventions are available on our website. We're happy to table them here. I'm not really sure what you're referring to in terms of an experiment. If the colleague could clarify, please.
Yeah, thanks very much, Minister. I appreciate that, because those were the words of Dr. Hanley, that this is an experiment. That's the original motion here, that the decriminalization of drugs that you're doing hand in glove with BC and the so-called safer supply is an experiment. So could you actually table with this committee the official government data to show that the so-called safe supply saves lives?
So the BC dashboard is available with all of the evidence collected today within the first year of the pilot. We're actually coming to the first year anniversary since the BC government requested the exemption on decriminalization of personal possession. All of that data is available and we're happy to table it. However, as the colleague well knows, this is a 3-year pilot program.
Clearly, Minister, we know that the number of deaths every day is going up, now stands at about 22 across our great country. When will you end this dangerous experiment?
The question is, how will we continue to save lives? That is my answer to when we will.
I'm sorry, Minister.
We will not stop providing
but I'm going to
healthcare.
interrupt you there, because my question was, 22 people are dying every day. That's increasing. Everybody here knows it. Everybody across the country knows it. That is getting worse. When will you decide to end the dangerous experiment?
My answer will be that we will never stop providing medical health care services and interventions to those who use drugs and substances. Every life loss is one too many.
Excuse me, are you suggesting that the so-called safe supply is a medically necessary and a medically proven therapy?
Suggesting that the entire comprehensive approach of a continuum of care, which includes a wide range of medical health services and interventions, is something that we are fully committed to save lives in this country.
So, Minister, I guess what I hear you saying, and correct me if I'm wrong, but is there any evidence that could possibly exist that would make you end your dangerous experiment? Even though the numbers are getting worse every year, you're not stopping it. You're telling us it's going to go on for 3 years. Is there anything that's going to make you stop the dangerous experiment? You're harming people.
The reality today is that the illegal toxic drug supply is pervasive and deadly, and I do not see any government stopping in its efforts to save lives from what is such a dangerous and pervasive illegal distribution of drugs across this country.
Minister, even though you know it's harming people from the studies that are out there, science, that you're going to continue that harm. That's what you're telling Canadians.
Evidence of overdoses today shows that the majority of overdose deaths are from the illegal toxic drug supply, and we will continue to fight and save lives.
Minister, just a little demonstration. We talked about decriminalization. This is not drugs. This is actually sugar. This is 2.5 grams. Realistically, the density is about the same as fentanyl. For Canadians out there to understand that this is 2.5 grams. And we also know very clearly that from...
Point of order.
Ms. Atwin, on a point of order.
Thank you, Mr. Chair. I'm just wondering about the use of props in committees. If you could rule on that, please.
Okay.
It is not.
Okay, I'm advised that the rules regarding the prohibition of props also apply to committee, so I would ask you to refrain from that. Dr. Ellis, thank you.
Well, I certainly would like to challenge the chair on that, Chair. I mean, this is absolutely ridiculous. We know that from many other committees Props are more than happy to be allowed in every other committee. I've been at Natural Resource, National Defense last night, Natural Resources early on in the week this week. Props were used, and this is an absolute travesty. We know that simple allowance to use props in committee has been something that has happened across a multitude of committees, many that I've just named, and your ruling, sir, is absolutely incorrect.
So it's a non-debatable motion, a challenge of the chair. So the question for the committee is whether the ruling of the chair shall be sustained. So the ruling that I made was that we are not going to allow props today, or ever. Please conduct the vote, Madam Clerk.
Ms. Atwin,
Sustain?
Mr. Hanley,
Sustain.
Mr. Juari,
Sustain.
Mr. Pulowski,
Sustain.
Ms. Sidhu,
Sustain.
Mr. Ellis,
Against.
Mr. Kitchen,
Against.
Ms. Goodridge,
Against.
Mr. Majumdar,
Against.
Madame Larouche,
Pour.
Mr. Johns.
Sustain.
Seven yeas, 4 nays.
The ruling of the chair is sustained. Dr. Ellis, you have 2 minutes and 18
Point of order.
seconds. Point of order from Dr. Kitchen.
Point of order. Mr. Chair, can you provide for this committee the actual ruling of your ruling, exactly showing us where it says in the books and in the orders that that's exactly for committees, please?
Dr. Ellis, 2 minutes and 18 seconds.
Well, thank you, Chair. You know what? And it's interesting that during this committee, we know very clearly that from the Canada.ca website, a few grains can kill you. And we know that that's true. And that would be simply a small amount of sugar if there happened to be any on my desk, a very tiny amount. And I guess the question is, do you think that that is appropriate, Minister, that now we're going to prescribe that to children?
I believe the colleague's question was also asked during a previous committee meeting to one of the officials, and what I'll say is that the decriminalization pilot is, first of all, anchored in reducing the level of stigma of those who use drugs to ensure that they get to treatment and access and care.
It is giving
And
drugs,
we've already-
giving very potent opioids to children, of which the Canada.ca website says very clearly a few grains can kill you. Is that appropriate?
So, Mr. Chair, my colleague did ask this question before, and I believe we've already tabled all the proofs on safer supply, and I'll be happy to table them again for further reference.
It's not the question, Minister. My question is do you think you should be giving an incredibly potent synthetic opioid, of which a few grains can kill you, to children? Yes or no? Simple.
Each physician works with their patient on the treatment protocols that work best for them. That is a very unique and important relationship that
Thank you
every
very much,
patient should
Minister.
have.
Appreciate that. Doctor-prescribed opioids are being sold on the streets. A Global News reporter was able to buy 26 tablets of hydromorphone in East Vancouver from the so-called government, taxpayer-funded safe supply. Total price $30, about $1 a pill. When you saw that report, what did you do, Minister?
I'm aware of the concerns about diversion. I've said it in this committee before, and I will say it again. Diversion is illegal.
action did you take? What did you do?
I'm happy to answer, Chair, if I'm not interrupted.
Yes,
Thank
please,
you.
please go ahead.
Since I'm aware of the physician's letter, I've actually met with the expert physicians who submitted the letter to me, and we also conducted a roundtable discussion with them, with department officials on January 30th, and we continue to consult with them on ensuring that we safeguard prescriber interventions that are safe.
So, Minister,
Thank you.
what I heard you say is you had a couple of meetings and actually did nothing about it. Well done.
That's the last question. Go ahead and answer it, and then we're going to move on.
in addressing the toxic illegal drug supply, to my colleague, I say that we need to use every resource and tool we have available to us and continue to consult with experts, including those who have concerns about prescriber models. Thank you, Chair.
Thank you, Minister. Next, we're going to go to Ms. Atwin, please, for 6 minutes.
Thank you, Mr. Chair, and thank you, Minister, for being with us and this incredible panel of department officials as well. And this is certainly a critical discussion for Canadians. And I'll just pick up on the last piece there of questioning around diversion. I know it's a important topic that we'd like to address. And I think nobody would be surprised to know that, of course, diversion is illegal, and it's an issue that applies to all prescription drugs in Canada. And it's, we have many doctors around the table that I'm sure make tough clinical decisions in their practice, balancing benefits and risks of intervention. Can you talk about mitigation measures put in place to diminish the risk of diversion?
I want to thank my colleague for the question. And as I mentioned previously to Dr. Ellis, we take these concerns very seriously, and which is why we asked officials to further investigate the anecdotal reports that had been made available. And we also wanted to ensure that we took steps that the pilot projects that we are funding have the appropriate and important safeguards and guardrails to control diversion and ensure that those measures were in place. In terms of actions taken, our officials undertook a detailed assessment of the risk mitigation measures that are all federally funded programs that are providing pharmaceutical alternatives are obliged to do. And the outcome of those actions of doing that detailed assessment was that most programs demonstrated very strong approaches and have a range of protocols in place to mitigate diversion. In the instances where further information or improvements are required, we've instructed officials to reach out to those sites and continue to work with them. We're committed to saving lives. Some of the steps that we've taken on these projects and ensuring that they implement the practices that we want to see in place to reduce the risks of diversion included patient screening, matching drugs to patient tolerance, risk-based protocols for assessing patient eligibility for take-home dosing, patient monitoring. Actions also included instances where there may have been diversion that we were concerned about. We took the option to switch the observed dosing prescriptions, transfer the individual to a different set of support services, or in some cases remove them from the program. We want to ensure that this is as safe as possible, and we also understand that, as everyone around this table, that diversion is illegal, and we will continue to maintain safety in our programs.
Thank you very much. And of course, we know there's no one-size-fits-all approach to this. As you mentioned, it's a multifaceted, pervasive epidemic that we're dealing with in Canada. And I am the Parliamentary Secretary to the Minister of Indigenous Services Canada, and so of course I'm going to have a lens here on supports for Indigenous peoples. So I'm just, with regard to supporting local organizations conducting this life-saving work, how do we best support the needs of these individual communities, and in particular in urban settings, Indigenous peoples?
I want to thank you for that very important question. We know that in the overdose crisis, when we look at the numbers, some of the most vulnerable and highest numbers and disproportionate numbers are within our Indigenous communities in terms of risk of overdose and deaths. And that disproportionate impact has to do with, decades upon decades of systemic and institutional racism, colonialism, and intergenerational trauma. And that lack of access of culturally appropriate substance use services and supports has been something that our government has been committed to addressing. Working with Minister Hajdu, as I mentioned in my opening remarks, we're working hand in hand to ensure that mental wellness and substance use supports are in place. We've allocated $650 million in the current cycle to ensure that Indigenous communities, both on reserve and off reserve in urban settings, are getting the services that they need.
Excellent. So I love to hear. Thank you so much. And I am the Member of Parliament for Fredericton, and we are one of the first original 5 sites for the SUAP projects. But we're also struggling with a lot of misinformation in community. Sometimes there's that NIMBYism that happens as well around the safe consumption sites and harm reduction measures. So can you explain why these interventions provide critical supports to those who use drugs and substances?
I'll thank you for the question. When we look at how we're going to tackle the toxic drug supply that is pervasive throughout the country and persistent and so deadly. We have to look at it as what is a full continuum of care in responding to this crisis, so that we're actually meeting people where they're at. And where we meet them is in community. And that's why safe consumption sites are so critical in terms of harm reduction as part of the continuum of care and services. Safe consumption sites open the door for those who use substances to oftentimes have their first encounter with healthcare service providers, with outreach providers, to understand what safety measures they should be considering when they are using drugs, and also to provide them with information, resources, and options for services towards wellness. Without that entry door, these people would be home alone or not even home, somewhere else, in vulnerable situations, exposed to the illegal toxic drug supply, which is the primary driver of the overdose deaths that we're seeing. The safe consumption sites are critical as part of our continuum of care. And reduction, if I may say this very clearly and resolutely in this place, is healthcare. It is a healthcare service, and I think once we wrap our heads around that and adopt that and understand that, we can really push back the tide on the stigmatization and misinformation that we're seeing.
Thank you. I just have a couple of seconds left, I'm sure, but I'd just like to give a shout out to my home community, to the Recovery Center and all the work that they do. I have the good fortune of attending Snacktivist Fridays and hanging out with those folks with that lived experience and learning about how this is improving their lives. They're getting a hold of their mental health. They're seeking meaningful employment and housing options. So that continuum of care is certainly an approach that's working in my community. So thank you so much.
Thank you, Ms. Atwin. Suite, Madame Laroche, pour 6 minutes, s'il vous plaît.
6 minutes, Madame Laroche. Thank you very much, Mr. Chairperson. This issue is far too serious to be politicized. I'm prepared to work today with rigor, just like my colleague whom I'm replacing today has the want to do, the member for Montcalm. Now, I'm very much interested in this issue. As a teenager, I remember meeting an advocacy group that was working on harm reduction when it came to substances, but also from a public health standpoint. And I'm a regional member of Parliament in the Grand Bay area, and we know that this issue is not just in major urban centres. And recently, I got wind of the fact that this is affecting the Grand Bay community and that people are dying. And this is having an impact on life expectancy. We're seeing that life expectancy is dropping across Canada. So I'd like to turn back to the regional aspects of this question. Minister, is there still money that the government is able to invest so that other communities can have access to the programs that are in place? As I said, Mr. Thériault met an advocacy group who work in a far-flung remote area, much more than mine, and they told him that to have access to services, folks had to drive for 2 or 3 hours, and they just didn't have enough money to bring the services to them. So what do you intend to do to help those people out in, not just in the major urban centres, but in remote centres as well? Thank you, Minister.
Merci à mon collègue pour la.
Thank you to my colleague for her question.
And it's one that we really do grapple with. One of the important pieces of the SUOP program, of which we just closed a recent funding cycle of proposals. We received 600 proposals from around the country to allocate $144 million. Were accepted from communities far and wide from throughout the country. Quebec is unique in its tranche of SUOP funding is that it is transferred to the province for its own decisions under its jurisdiction. That being said, through SUOP, we have looked at programs such as the NORSE overdose call hotline, which makes it accessible for anyone to call from wherever they are in the country if they are using substances to be able to be monitored safely while they are using. We will continue to work with communities, including rural and remote communities, as they offer proposals to us for consideration to how best support. The communities know what they need best, and we will continue through that lens.
Oui, et vous l'avez bien dit, Madame.
And you've stated it clearly, Minister, Quebec is unique, and I'll come back to that a bit later. But there's a lot of work in the mental health field that's occurring in Quebec, and I hope that you bring back that work to your colleagues, share it with them. The important work with regards to healthcare transfers, Quebec is working in a unique way to implement its particular projects. Now, in the past, I worked at a community organisation that focused on mediation. And I rubbed shoulders with other community groups at the time. I heard about a similar initiative at the time to do with prevention and education. And I met an organisation that was tasked with broadening awareness about these kinds of things. Now, Health Canada sought to contact 2,000 festival organisers to provide them information about naloxone and provide them prevention material and documentation regarding overdose, both to the participants and organisers of those events. Where are you at in that process, and to what extent have you reached out to those organisers?
I want to thank my colleague for the question, and I will acknowledge Quebec does have some incredible innovations. My counterpart, Minister Carman, has shared with me the work being done in Saint-Henri on a very innovative project there that has full wraparound services, including a safe consumption site. But you raise a very important point of how valuable the work is that we do with outreach organizations in community. I was recently in Calgary and met with workers there who do exactly that. They are in touch with festival organizers, rave organizers, other cultural events to ensure that there is a wide range of harm reduction resources available to participants, whether it's ranging from condoms to harm reduction tools that they would need, including drug checking strips and so on and so forth. And this is work that we, through SUOP, that we are able to support and fund so that our very dedicated and committed and compassionate outreach workers around this country who work in community really understand where they are, where they need to meet those who are using drugs, where they're at, so that they can provide that first entry point for creating safety and also upstream prevention and education. So SUOP is an amazing tool that we continue to support and use, and I'm excited to see the new round of proposals and programs as they roll out this year.
Madame LaRouche. Next, Mr. Johns, please, for 6 minutes.
And thank you, Minister, for being here, and especially to your team and all the people on the front lines of this crisis. Minister, you read the article, I'm sure, in the Globe and Mail. It was a new research report that was released to the public, and it cited that British Columbians who were at risk of death related to illicit opioid use were 61% less likely to die from any cause in the following week if prescribed at least 1 day's supply of a pharmaceutical alternative. According to this research, it also stated that if they received 4 or more days of safer supply in 1 week, the rate of any cause of death was lowered by 91% in the next week, and death from overdose was reduced by 89%. Now, in British Columbia, there is 4,265 people on a safer supply pharmaceutical drug alternative. That's only 1.8% of the 225,000 daily users of illicit substances, that toxic drugs, that the other 98.2% are relying on, you know, the organized crime and the street toxic drug supply to meet their needs. Minister, looking at that, the scientific evidence demonstrates that the life-saving impacts of safer supply clearly is critical, and I'm concerned that your policies have been, you know, created based on not on evidence, but because if you went on the evidence, you wouldn't take an incremental approach. You'd be scaling things up. And I'm concerned about the fear-mongering that's coming from Conservatives, and also the hesitancy to extend funding for the 21 safer supply programs that are providing effective care right now to thousands of people. Because, you know, my understanding is if, you know, prescribing data, that cutting the funding to these programs is dooming about 30% of federally funded safer supply program clients to their death within 6 months of ending those programs. So I guess I'm looking for you. Minister, what will you say to those families in 6 months if SUOP funding for safer supply programs is not renewed?
I want to thank my colleague for the question, and I always appreciate that you are such a strong advocate, not only for your community, but in tackling collaboratively the overdose crisis and the illicit toxic drug supply that is impacting so many of our families and communities. There are 24 safer supply programs in the SUOP at this moment in time. As I mentioned in my earlier comments, officials have been doing extensive reviews to ensure that diversion mitigation measures are in place. The new funding round of proposals has been accepted and is under review, and announcements will be coming soon for the programs that applied for, and amongst those, if they applied for renewed support, they will be available. They will be considered under that proposal program.
Minister, these people's lives are at risk. This is real. And Minister, I want to state a few things here, because this shouldn't be, and we're hearing the conversation here at this table, that it shouldn't be about recovery versus harm reduction. And, you know, there are mountains of evidence on the effectiveness of harm reduction programs like supervised consumption services and now safer supply. Will the Liberal government create policies based on evidence, or will they do it on reaction to the fear-mongering that's coming from this side? Let's look at the evidence of what happens when fear-mongering shuts down harm reduction programs. And I'm going to go back to the Conservatives, because it shouldn't be recovery versus harm reduction. We need both. In Alberta, banning of safer supply, closure of supervised consumption services, and adoption of a recovery model that lacks evidence and regulation has led to an 18% increase in drug toxicity deaths this year over 2022. In Saskatchewan, where harm reduction has been abandoned in favor of a recovery model, deaths in 2023 increased by 32% over 2022. Saskatchewan also has the highest rate of HIV in Canada, 19 per 100,000. In Ontario and BC, where there are relatively robust harm reduction programs, deaths are also increasing due to the unregulated fentanyl supply, but at significantly lower rates. BC deaths are up 5%, Ontario 6.8%. Again, compared to 18% in Alberta and 32% in Saskatchewan. Any increase in deaths is not acceptable to anyone at this table. It's a policy failure and morally reprehensible. But the Conservative anti-harm reduction and anti-safe supply disinformation campaign is most active in the provinces with the highest death rates. Minister, the data is clear, yet your government is stalling on providing SUAP funding for safer supply programs. Are your government policies on this issue based on evidence or opinion polling that is influenced by the false narrative of the Conservatives?
Chair, how much time do I have to answer?
A minute and 15 seconds.
Okay, so I agree with my colleague wholeheartedly. In addressing the overdose crisis, there is no either or. It's not a harm reduction or treatment. It's not safer supply or recovery. As I've said, and I will repeat again, we need a full continuum of care and healthcare interventions and services to help those who are most vulnerable and struggling with substance use. With regards to your question, Mr. Johns, we've contacted all of our programs on safer supply that are expiring, and it is my full intention to have our department review and renew those programs with proper mitigation measures in place with regards to concerns that have been raised on diversion. We do know there is evidence. We are collecting data. We are collecting evidence through CRISM, through these. That is exactly why SUOP exists, so that we have evidence to show if these measures are working. We know that those who are on safer supply programs begin a process of stabilization. They begin to make better health choices for themselves. It reduces criminal activity. It reduces someone going on the street to look for other alternatives to pay for illicit drugs that can cause them harm. We have to meet people where they are at in the moment when they reach out for help. That is why safer supply is such an important piece of the puzzle. And when we go to save lives, we cannot do an either or. We cannot stigmatize people when they actually step up and ask for help, to turn them away and say, no, it's either this or nothing.
Okay,
they
thank you.
will die of overdose if we do not meet them where they are
Thank you,
at.
Minister.
And I say this as the Minister of Mental Health and Addictions,
Thank
that
you.
it is my sole focus to save lives.
Thank you, Minister. Ms. Goodridge, please, for 5 minutes.
Thank you, Mr. Chair. Minister, you're a mom. I'm a mom. And recently in BC, protocols have been put in place to allow so-called safe supply of fentanyl to kids under 18 without parental consent or knowledge. My question is simple. Have you met with the Prime Minister to put a stop to this?
I think the more important question is to meet with the experts who are involved in the prescriber intervention models that you discussed, because they are truly the experts in this field, which is something that we have done. And like yourself, I am a mother.
Have you met with the Prime Minister, yes or no?
I meet with the Prime Minister regularly.
Have you met with the Prime Minister to discuss fentanyl to children under 18 and putting an end to it, yes or no?
The question should be asked is meeting with experts and physicians who are responsible for prescriber models to their patients. Medical
So you're
practitioners
okay with children under 18 getting fentanyl
the question was
prescribed?
whether or not I met with the Prime Minister. That was not, the question was not
Then
whether or not.
Are you okay with children under 18 being prescribed fentanyl, yes or no?
I am comfortable with medical practitioners meeting with their patients.
Okay,
to
thank you,
understand
Minister.
what is best
So
for their
on
patients.
September 26th in question period, you said decriminalization was the first step. What's the second step?
Harm reduction. There is prevention, there is harm reduction.
Okay,
There
thank
is
you.
treatment and recovery.
So have you had any conversations about legalizing drugs like heroin, cocaine, and meth?
The decriminalization program is not about legalizing illicit drugs. The decriminalization program pilot project that was requested by the BC government is about reducing stigma, those who are in personal possession, to be able to access medical
Okay, thank
services
you.
and interventions.
So what is your stance on publicly traded companies like Safe Supply Streaming Company and Lucy Scientific, who are selling stock based on what they seem to predict as a legal market in Canada for drugs like heroin, cocaine, and meth?
I don't work in hypotheticals. I work in the realities of this moment.
This
and
is
in
the
the realities of this moment are that the interventions that we work with the BC government and with many jurisdictions across the country based on prescriber-based interventions. If the market
Minister?
wishes to speculate, that is the market's choice.
Minister?
We are fully committed to a
Please.
prescriber model.
Go ahead, Ms. Goodrich.
So are you committed to no more legalization of hard drugs in
We have
Canada?
not legalized hard drugs.
Will you? You have. You legalized marijuana since forming government in the last 8 years. My question becomes, are you looking to legalize more drugs, yes or no?
We have not legalized illicit drugs.
Okay. So, Minister, I know we've had conversations.
Chair, do I have another moment to answer on that?
No,
No? Okay, thank you.
go ahead, Ms. Goodrich.
What my colleague was trying to show earlier with the fact that a few grams could kill somebody with fentanyl, and yet you've allowed a decriminalization pilot project to allow up to 2.5 grams, which most Canadians aren't familiar with grams because we don't do our baking or our measuring in grams. It's a lot. It's a lot more than a couple grams. And so it's terrifying that we are allowing people to just have free will on this. When I asked your predecessor at committee, what would it take to stop the decriminalization pilot project, this experiment on our society? She said very clearly, both on the public health indicators and the public safety indicators. What we're seeing is out of control crime and chaos on our streets and increase in overdose deaths. And yet you very clearly said that you are A-OK continuing on with this decriminalization pilot project. Is there anything that could happen that would make you stop?
Okay, now, Minister, you have a full minute without being interrupted. Go ahead.
Thank you, Chair. So I'll start by saying the 3-year pilot exemption that was asked for by the BC government was put forward after extensive consultation, including of the amount of 2.5 cumulative threshold. And I would note that not while it was approved by Health Canada, it was supported in full by the Canadian Association of Chiefs of Police. So this wasn't done without consultation. It wasn't done without careful consideration. But I would also note the composition of the drug supply at this time is changing. It's deadly, and the substances that are in it are frequently unknown even to those who use them. So to posit that it's specifically one drug in that 2.5 is really not facing the reality of what's on the streets that is so deadly to those who are using them.
Thank you,
That-
Minister. And thank you, Ms. Goodridge. Next, we're going to go to Dr. Hanley, please, for 5 minutes.
Thank you very much. And before I forget, I will cede my last 90 seconds with your assistance, Chair, to my colleague, Mr. Morris. Minister, thank you for being here, and thank you, officials, a distinguished panel of officials for being here, and thanks for all the work that you're doing. I just wanted to note a couple of things. First, the Yukon coroner just announced last week 23 Yukon deaths in 2023. And although that might sound like a fairly small number, that's in the rate of 50 to 51 deaths per 100,000. Again, showing how this is affecting smaller regions and jurisdictions in Canada just as much as anywhere else. The toll weighing very heavily on First Nations communities as well. Briefly on the on my colleague Dr. Ellis's use of the word experiment, I just wanted to say that really the reason for putting the word experiment is trying something new, and that is when if we are trying old stuff and doing the same thing over and over again, I think someone much smarter than me called that the definition of insanity. And so an experiment is really determining the efficacy or likelihood of something previously untried, and I think that is the idea behind new models such as decriminalization in BC linked with safe supply, harm reduction, and the other pillars of care. If there is a failed experiment, surely it's prohibition. I am not sure of a single example where prohibition has actually worked. I would also say that if we go to a purely recovery-based model and discourage the other pillars, as some jurisdictions are trying, then we are getting towards approaches that are based solely on values rather than public health evidence. So. But in view of my time, Minister Sachs, I do want to give you a chance to answer a question, and this is around the new substance use strategy that was published, along with the funding, I think $359 million in budget 2023. I want to know a little bit, perhaps in a minute or less, your discussions with provinces and territories and how you see building consensus towards approaches that make the best use of this money, $359 million over 5 years, and the controlled substance strategy.
I want to thank my colleague for the question, and the renewed CDSS is really about what the Canada model truly is, of ensuring that we have a full continuum of care that recognizes the social determinants of health and also the social determinants of vulnerabilities that result in individuals becoming substance users, which is why the CDSS will be working with 15 different departments. Excuse me. My apologies. 15 different departments, including housing, including Indigenous services and others, to ensure that we are looking at all of the pieces of the puzzle, including enforcement, so that when someone seeks help through the healthcare system, they are fully supported. And that's the vision that we have.
I'm sorry, I'm going to have to cut you off there to defer to my colleague to continue, also to allow you to catch your breath.
Mr. Morris, please.
Thank you, Mr. Hanley. Minister, thank you again for making clear today that safe supply saves lives. A father in my community, Dale, recently wrote me about his daughter, Kayla, who very sadly died from an overdose death from poison drugs last April. From his letter, quote, "Had Kayla had access to a safe supply, she would very likely be alive today." I'd like to share this letter with you, Minister, and as you know, this is not an anecdote. It's what 130 experts in substance use wrote to you about in December, noting the 15 peer-reviewed research studies and 5 program evaluations that back this up, as documented by the Ontario Drug Policy Research Network. This is the reality of the peer-reviewed research we have. I appreciate what you've shared already this morning at a time when safe supply contracts that are currently in place, including with Sanguine Health in my community, are set to expire in March. Can you confirm that Health Canada officials will not be swayed by any disinformation on safe supply and will continue and if not increase funding to safe supply through the Substance Use and Addictions program?
A brief answer, please, Minister. We're out of time.
We are fully committed to a full suite of resources and tools to help those who struggle with substance use. Safer Supply is one of those tools, and we will continue an evidence-based approach that is compassionate and meets people where they are to get them the help that they need.
Thank you. Madame Larouche, s'il vous plaît, pour 2 minutes.
2.5 minutes, Ms. Laroche. Thank you, Mr. Chairperson. Minister, in Quebec, there was a face to this opioid epidemic at the start of the year. Mathis Boivin, 15 years of age. All my respect for this 15-year-old young person who has sent out a media message to the media. Let's do away with taboos, stigmatization, and that has come about through the forceful message that he's sent out so that parents and children can discuss these issues. So my condolences to Mathis Boivin's family. Minister, turning to another subject, you talked about Mr. Cadma and his program in Quebec. And one of the previous times that you discussed the issue with my colleague Luc Thériault, you said that Quebec had an excellent program to combat mental health issues. Mental health has to do, of course, with substance use and abuse. What are you waiting for to transfer to Quebec the money it needs so that it could put these things into practice out in the field?
With regards to the $200 billion that the federal government has committed to with provinces and territories in bilateral agreements, we are moving through the process of securing those agreements. Some have signed. Quebec is still in negotiations. $25 billion of that money is also dedicated specifically when it comes to mental health and substance use resources. I am confident that Quebec, like all other provinces and territories, will conclude their agreements with us to ensure that the good work that they do continues.
Well, what would really help, and what Quebec is calling for, is an increase to the health transfers in a meaningful way. So we're talking about an increase in the ballpark of 35%, but we can come back to that at a later stage. Now, to combat the import of illicit drugs, border measures need to be tightened. The last time you appeared, you talked about a targeted approach for opioids. Is that going to be on a data-based approach? And what are your thoughts in respect of that?
That is a question that we are working directly with Public Safety Minister LeBlanc. Some of our conversations to date have also focused on the impact of precursors coming into Canada. This was part of my discussions actually when I was in Washington in November with my counterpart there as well, and has been raised in other forums. We are part of a number of collaborative groups. I think Jen Sachs can speak to this in more detail of the collaborative work that we're doing cross-border with the United States to address enforcement and border measures. Jen?
Sorry, Ms. Sachs. We're going to go to Mr. Johns. I know that you're going to be with us in the second hour, and I expect you'll get a chance to expand on it then. Mr. Johns for 2.5 minutes, please.
My colleague just talked about mental health, and you cited the commitment of $25 billion over 10 years, $2.5 billion years, but you didn't talk about the fact that it's over 4 priority areas. So I did the math, and you're falling short on your commitment of $4.5 billion over 5 years to deliver mental health by $1.375 billion. I've talked to you about this, about creating a direct fund to make up for that gap, given that we're in a crisis when it comes to mental health and for post-COVID recovery. Are you considering looking at what I've talked to you about and delivering something in this budget?
As I've mentioned previously, we've made a commitment with provinces and territories of $200 billion over 10 years, of which mental health and substance use is one of the key pillar priorities. We know that as I said in my opening remarks, mental health services and substance use services really need to be part of universal healthcare systems in each of their jurisdictions. This is what we're moving towards in these bilateral agreements. We don't have all of them in place yet. In weighing out considerations of additional funding, we are encouraged by what we've seen so far in the proposals of the agreements that we've seen, of the investments that provinces and territories are making. And as I mentioned, also meeting quarterly with my counterparts, we are pushing them to make those commitments with the budgets that they're receiving.
We're hoping that you're going to increase it. Minister, Sachat Nation in my riding hosted the Alberni Valley Toxic Poison Drug Strategy yesterday, calling for a whole-of-government approach is what you talked about. They need you at the table for resources in your government to do that in an urgent way. We talked about Portugal scaling up on safer supply from 250 people to 35,000 in 2 years. They engaged the military. You still have not delivered a plan with a timeline to show that you're demonstrating an emergency. Now, Minister, I want to introduce you to Teresa. Teresa is a 32-year-old Indigenous woman who has stabilized her substance use on Safe Supply. If SUIP funding for Safe Supply ends in 2 months, she doesn't know, if the new life she has built will be ripped apart. And I guess, Minister, could you look at Teresa in the eye and tell her that funding is ending, so she will have to go back to sex work, back to unregulated street fentanyl, back to chaos, back to violence, back to criminality? Or, Minister, might Teresa be one of the 3 out of 10 Safe Supply clients who will be dead in 6 months? Are you going to commit to extending that funding?
I've already said in my comments to Mr. Morris and you that
the existing projects, are you going to extend that funding?
We've contacted all of the existing programs that are expiring, and it's my intention to renew those that have proper mitigation
So
measures.
Teresa can count on you?
Canadians can count on the federal government to ensuring that we put every resource and tool available to save lives of those who use substances.
Thank you, Mr. Johns. Thank you, Minister Sachs. Next, Dr. Ellis, please, for 5 minutes.
Well, thank you, Chair. Minister, it's pretty clear what we've heard. You're okay giving fentanyl to kids without parental consent, and you will not rule out the legalization of other drugs like cocaine. Have you read this study from the British Medical Journal talking about mitigation guidance on opioid and stimulant dispensations? Just came out in January.
No, I have not read it.
Right. It's interesting because my colleague, Mr. Johns, referenced it, and clearly he presented the biased option, which sadly misuses the study and doesn't talk about the opioid agonist therapy, which exists inside the study but is not talked about inside the study. We're firm believers on this side of the House that opioid agonist therapy and rehabilitation is the way to go. What we're having a trouble with, and what you've clearly failed to see, is the difficulties associated with your so-called safe supply that is actually harming people. So the question is when will you read this study, and when will you take actual science and the criticisms of this paper into account when you're making your policies?
Mr. Chair, we do have an expert in the room here on research and evidence and peer-reviewed reports, so I'm going to turn it to Dr. Sam Weiss, if I may, to answer Dr. Ellis.
Thank you very much. The study that has been referred to from the British Medical Journal, published in January, was funded by the Canadian Institutes of Health Research, and we're very proud of the important work. There's
Excuse me, sir. I realize that I asked the minister the question, but get to your point. I guess the question is, I don't care who did it. Have you read it? And do you know the criticisms of that paper?
Yes, I have. And I know
and when are you going to take into account the criticisms for that paper when you're creating your policy on your so-called safer supply?
Right, so I don't create policy. I'm a researcher. But
Thank you very much. I don't need an answer from you then. That's very good, because the person who's signing off on the policy isn't reading the paper and clearly is not getting good advice. So I'll turn the time over to my colleague, Ms. Goodridge.
Thank you. What is your stance, and do you believe that drug users should be able to use drugs in children's playgrounds?
We signed an exemption at the request of the BC government, an amendment, my apologies, in September with regards to playgrounds.
So you don't think that drug users should be allowed to use drugs in children's playgrounds?
I believe that in addressing the opioid crisis and the overdose, the level of overdoses that we're seeing, that we need to have a clear anchor both in public health and public safety.
I'm asking a really simple question. So yes or no, should drug users be allowed to use drugs in a children's playground?
We signed an amendment at the request of the BC government in terms of demarking public use with regards to playgrounds, splash pads, and other public areas.
Do you believe that recovery from addiction is possible?
I think that everyone's journey is unique and that recovery is possible for those, but it often, in many cases, the evidence shows that it takes more than one try.
Do you believe that we should have a recovery-oriented system of care in place in Canada?
I believe we need a full suite of services and a continuum of care that includes prevention, harm reduction, treatment.
Do you think it should be easier for people that struggle with addiction to access treatment than drugs?
I think that an individual who struggles with substance use should have the lowest access barriers to get help and medical services.
So do you believe that people that struggle with addiction should have easier access to treatment and supports that help them get to treatment than drugs?
That they should have the lowest barrier access to all medical services and supports that can help them with their substance use towards recovery.
Do you believe that we should start restricting the amount of drugs available on the streets so as to reduce the number of new addictions?
That would be with regards to enforcement on the illegal toxic drug supply. Is that what you're referencing?
Well, I'm wondering because what we have been seeing is so many stories coming out about the diversion. There are facts and stats coming out about drugs being diverted from safe supply programs getting into the hands of kids. So I'm wondering if you think that we should be far more strict. If you're going to continue allowing drugs to just be flooded into the streets, do you think there should be witness programs? Do you think that there should be spaces so that they cannot just carry those with them and potentially sell them to kids at playgrounds?
In my answers to Ms. Atwin earlier, so they are on the record, we talked about the extensive mitigation steps that we have taken with those safer supply programs to ensure diversion is mitigated as much as possible. As I said, diversion is illegal in this country and continues to be so.
It's still happening. Drug use is illegal. It's still happening.
It is.
And so my questions are very pertinent. And frankly, I don't want to see so-called safe supply at kids' playgrounds. That should never happen. And yet we see it. We see it day and day and day.
Anecdotal evidence.
Sorry, that's your time, Ms. Goodrich. Go ahead and finish your answer,
You've referred
Minister.
to anecdotal evidence. What we have done is taken rigorous mitigation measures with safer supply programs. But in addition, am I at time, Chair?
Finish your thought, please.
What I will say is that when the exemption was put into place at the request of the BC government, BC chiefs of police at that time said that they had every tool available to them and resource to ensure public safety in public spaces. It was at the request of the BC government in September that we signed off on additional amendments, again, at their request. We continue to work collaboratively and comprehensively and assess and monitor the exemption. Thank you.
Thank you, Minister. And the last round of questions for the Minister will come from Ms. Sido, please, for 5 minutes.
Thank you, Mr. Chair. Thank you, Minister and official joining us today. In April 2019, this committee traveled across the country to witness firsthand the impacts of the rise of problematic methamphetamine use, that it was an eye-opening study for all of us. Back then, what we see, stigma associated with the substance use and addiction was identified. That was a significant issue we have to address. Can you, Minister, talk about that to the committee, the work you are doing and your department are doing to combat stigma?
So there's a full suite of tools that we need both in the prevention space and in the harm reduction space to address stigma. And it starts by really creating spaces within communities to meet people where they're at. And that is why programs like SUOP provide such comprehensive outreach programs. And the workers there are incredible. The work that they do day in and day out is compassionate, it is caring. It's also anchored in evidence of what works best to meet those who are most vulnerable in their needs to get them to medical care and assistance. but that is just one piece of the puzzle. There is prevention work that we're doing, particularly when it comes to youth. Our integrated youth service support has been so significant in understanding how our young people in communities at vulnerable stages of life really also need interventions that are community supported so that they are protected and supported in a world where the toxic drug supply is so pervasive. Dr. Weiss can speak to some of the early evidence of the integrated youth service of how it is working and how it's being implemented, but we've also committed $20 million towards the Icelandic model that will be rolled out this year to meet youth and also reduce stigma. Dr. Weiss?
Sorry. Right, so thank you. The Integrated Youth Services model, which is now active in 9 out of our 13 provinces and territories and in 8 Indigenous communities, seeks to provide a community-based program for individuals to receive mental health and substance use care, as well as all related services that can allow them to have the best chance for a trajectory, a healthy trajectory, includes sexual reproductive services, housing services, and the like. And it operates under a model called measurement-based care, which means that every individual who is seen, it's walk-in, no appointment, no referral required, has their services, and they participate directly in measuring the actual outcomes. And this is a transformational moment because we hope to see this level of service available, including at a virtual level as well for those in outlying regions where the kinds of services needed at the most vulnerable period of time when young people are at highest risk for developing substance use disorders as well as chronic mental illnesses is made available. And what's remarkable is that it's working from the grassroots up. We have municipalities, communities, provinces, and the federal government all working together because community health is the future, and that's why we're very enthusiastic about it. If you complement it with what is hopefully to be adopted, the Planet Youth model from Iceland, which seeks to have communities come together to ensure that young people are not diverted away from healthy activities to unhealthy activities, you start to focus on the upstream issues that really lead ultimately to addiction and chronic mental illnesses. And as part of our strategy, I think as a country, we have to recognize that youth are the most vulnerable, and if we're able to provide them with the resources needed where they're at, there's a greater likelihood that we'll stem the tide of individuals susceptible to the increasing toxic illicit drug supply.
Thank you. Minister, I came across an interesting study from the University of Alberta from last year that studied the public opinion in Alberta and Saskatchewan for safer supply programs. The majority of respondents, almost 64% in Alberta and 56% in Saskatchewan, supported safer supply programs that replace illegal street drugs with pharmaceutical alternatives for those unable to stop using. The study suggests that there's no lack of public support towards these measures. Can you share your thoughts with this committee about the diversity of opinions Canadians have towards this issue?
As briefly as you can, Minister, please.
I would say that this is why, in combating stigma, if we go back to your previous question, why we need a full suite of resources and supports that include prevention and harm reduction, including safer supply, because we understand that when you meet someone where they're at in their struggle, at their most vulnerable, when you see them and you get them to safety, that is when we break down the walls of both stigma but also bring people to a better place in their health.
Thank you, Minister. That concludes the first hour. I want to thank you for accepting our invitation to be here with us and for the patient manner in which you took our questions. I know the format is difficult. It's not always easy to give a very short answer to a very short question, but you've handled it well, and we certainly appreciate you being here, appreciate the work that you do and the passion that you bring to the work that you do. We're going to suspend to allow the Minister to take her leave, and then we're going to continue on with officials in about 5 minutes. We're suspended. Getting back to order, we now have with us officials who were introduced at the outset of the meeting, so I don't think we need to do that again. I don't believe anyone has an opening statement, and if I am correct in that, we can go right to questions, beginning with the Conservatives. Mr. Majumdar for 5 minutes, please.
Thank you, Chair. Greetings, Ms. Sachs. Recently, a new fentanyl prescription protocol was established in British Columbia, and under this protocol, physicians are allowed to prescribe fentanyl to children without parental consent or awareness. Have you raised any concerns to the minister about being prescribed fentanyl, a drug so toxic that Health Canada's websites state that even a few grains could kill you?
Thank you for the question, Chair. We've spoken to the minister at length about the crisis writ large, about developments in British Columbia. With respect to the prescription guideline that you're describing, we've made the minister aware that based on our conversations with the BC government, the latest information we have is that while the guidance has been enacted, no prescriptions have in fact been provided to anyone under the age of 19. That would be about the extent of the conversations we've had at this point with her on that particular guidance.
So if you don't mind me, when were you first made aware of the protocol?
I honestly couldn't say on the spot here.
Could you table it with the committee?
Could you table it with the committee when you do discover at what
Sure,
point
yeah,
you found
absolutely.
out? Thank you. And so, did you end up providing a briefing to the minister on the protocol change? And if so, what did that briefing include?
I don't recall that there was a specific briefing on that exact protocol. The conversations happened in the context of her mandate writ large with respect to the crisis and developments that are happening week over week throughout the country.
So this protocol has a significant consequence on Canadian kids. Do you know when the minister became aware of the protocol change?
I couldn't give you a date.
Well, it seems, you'll forgive me for being a bit shocked by that. It's a pretty significant thing, and being briefed at large is one thing. You'd think that the minister, I'm not putting you on the spot, but you'd think that the minister would be asking a lot of questions of her officials. Did she ask any questions of her officials? Did her office reach out to you to get a sense as to what this was all about?
Yeah, I mean, I can say with complete confidence, the minister is very, very engaged on the crisis, the situation in British Columbia, and frankly throughout communities across the country.
Let me ask you, should drug users be able to use drugs in playgrounds? What's your actual view?
Well, as a public servant, I don't know that my own personal view features too prominently in this. But
professional view?
Well, my professional view would be to sort of add to the minister's response, which is in response to the BC request last summer to amend the exemption to exclude playgrounds and other places. The minister signed off on that exemption, and we provided an amended exemption which excluded playgrounds and other public places.
So that means that the view of officials presented to the minister is that drug users should not be able to use drugs on playgrounds.
We supported, we had no cause to brief other than in support of BC's request to make that amendment to exclude playgrounds and other public places.
And have there been any consultations by yourself, your colleagues, on legalizing drugs like heroin, cocaine, and meth?
No.
Definitively, absolutely no conversations of legalizing any of these hard drugs?
So my job, our job as public servants is to execute the policy of the government. And the policy, as I understand it, is not to pursue legalization or decriminalization of other substances beyond what is currently in place.
Well, thank you. I appreciate that view a great deal. It is clear that fentanyl being prescribed to kids leads to addictions, leads to death, drives down the price of illegal drugs on the black market up to 90%. At what point will the evidence that's been assessed lead officials to recommend to the minister to end the so-called safe supply of drugs that are killing Canadians, killing kids?
So thank you for that question. I guess my response to that, even just sort of observing the conversation that's happened so far this morning, is that I can say unequivocally that the department right now is taking into full account all of the evidence that's being brought to bear, whether it's the published evidence that's been some of which has been referred to, whether it's data that we're collecting from our own sites, in order to ensure that we have a full and clear-eyed and systematic view of the situation, and that the decisions will then follow. And as the minister said earlier, where as it pertains to federally funded projects, as the minister just stated, that where we see a continued adherence to strict protocols to mitigate risks of diversion, the anticipation is that they would continue. But I think the minister's also been on the record saying, in the absence of that, we're also prepared to take action.
Thank you, Mr. Costin. Next, we're going to go to Mr. Johari, please, for 5 minutes.
Thank you, Mr. Chair. I'd like to get some feedback from you, Mr. Costin, and I'll start by highlighting the fact that our colleagues across, specifically the Conservatives, over the last 50 minutes, they're trying to portray an image of a government that is decriminalizing the drugs and is making drugs available on the streets, and their only claim under harm reduction is designed to convert these so-called legal drugs into the street and go to the children, playground and sell it to them, and that's it. That's our scope of the work that we are trying to do as it relates to opioid. No mention of the work that we're doing on prevention, no mention of the work that we're doing on treatment. Really kind of changing the channel on the work that we are doing under harm reduction and kind of pointing all of these activities, as well as the scope of the drug decriminalization that we have, and just pointing it into a study that it's being done, a pilot that's being done, whether it's experiment, whether it's pilot, whether it's whatever it is you want to call it. And therefore, Canada is in crisis, which I agree that as it relates to that, we are in crisis. But simplifying this, our approach into dealing with this crisis to basically decriminalizing drugs and putting drugs out through conversion into the street, it's not fair. And I'd like to give you the rest of the 3 minutes that I have to be able to kind of break it down for Canadians out there, that there are 4 pillars. Each pillar is designed to serve a very clear purpose. They work hand in hand, and we are at the early stages of collecting data, and hopefully this data will guide us rather than 5-minute clips that goes on social media for, I don't know, likes. So I'll stop. Please, Mr. Cost.
Okay, thank you very much for the question, Chair. I'll do my best in a brief moment to explain the full strategy in concrete terms. So as the Minister said in her remarks, really the focus of the government's response to the crisis over several years now has actually been to try to be as comprehensive as possible. So that's moving forward a series of measures and initiatives to prevent drug use from occurring in the first place. And so Dr. Weiss referred to some of those initiatives. There are many others that are really focused in the so-called upstream end of the spectrum, where we're looking to delay or prevent initiation from occurring in the first place. There are also a number of initiatives targeted at reducing stigma. Some of the members of this committee have made reference to stigma and just how much of a barrier the stigmatizing nature of having a drug problem creates with respect to integrating into all aspects of our society, including being able to access care. And so there are a number of initiatives that are focused on reducing stigma. The exemption provided to BC is one example of that, but there are others. There's a lot of conversation around harm reduction. The conversation around prescribed alternatives is clearly one that is top of mind to this committee and many Canadians. That intervention and other harm reduction interventions are really in place as life-saving acute interventions in response to the problem that we're seeing play out in Canadian communities right now, which is the drug supply in Canada is 80% fentanyl and increasingly adulterated by other substances, which make the risks of using drugs extraordinarily high, and that's why people are dying. And then we have treatment interventions and enforcement beyond that. Thank you.
I got another 30 seconds. So can you quickly tell us what is the scope of the drug decriminalization in our government agenda?
It is the exemption under the Controlled Drugs and Substances Act that would allow for the possession of small amounts of drugs in British Columbia.
Thank you, Mr. Costin. Suite, Madame Larouche, pour 2 minutes et demie, s'il vous plaît.
2.5 minutes, Ms. Larouche. Thank you very much, Mr. Chairperson. And thank you to the officials from the Department of Health, the Public Health Agency of Canada, and CIHI. I'd like to follow up on my previous question about the importing of illicit drugs. Now, in a Health Canada document, you said that you wish to control these substances by working with partners from the private sector in order to reduce money laundering that is leading to the trafficking of fentanyl. The focus is on safe supply, but we get the sense that nothing is occurring to reduce the size of the illicit market. I'd like to hear your thoughts about that. Are you making headway, meaningful progress in that area? And could you please talk about your fight to lessen the size of the illicit market? Thank you very much for the question. If I might, I'll respond in English. It'll be a tad easier for me.
Thank you again for the question. So strictly speaking, I'll be able to give you a brief answer on the extent to which law enforcement agencies throughout the Canadian government are looking to reduce the size of the illegal drug market. As an employee at Health Canada, my ability to speak to that is somewhat limited. The Public Safety Ministry would be the primary responsibility, but I can say that there are a number of activities underway, both within just domestically within Canada, targeted at serious criminal activity in the production and trafficking of illegal drugs. Importantly, the crisis that your committee is studying is in fact a continental crisis. And so the experience that we're seeing in Canada is very much shared in the US. So the enforcement activities that Canada does to try to disrupt major transnational criminal organizations is actually done in very close partnership with the United States. So those are border controls to stop precursors and fully formed drugs from coming into the market. It's working with the U.S. Postal Service and the Canadian Postal Service to ensure that there are mechanisms in the mail system, because we know that drugs, because they're so potent, are often transmitted through the mail. There is actually a White House Prime Ministerial Action Plan on the opioid crisis, which is largely directed at enforcement activities. There's a trilateral fentanyl working group, which again brings together law enforcement agencies from Mexico, the United States, and Canada to look specifically at the question of fentanyl trafficking. So there's quite a bit happening here, and that's just like a top level, un aperçu.
Merci, Mr. Costin. Next, we're going to go to Mr. Johns, please, for 2.5 minutes.
Thank you. So question I have is clearly, we're hearing about diversion and concerns around that. I can tell you right now, you can go and buy toxic drugs in any community across this country and die, which is happening right now in our communities. What evidence do you have that diversion is causing harm that you're hearing from the Conservatives? And there's very strong evidence that people receiving safer supply have reduced overdose and all-cause mortality and reduced emergency department use and hospitalization, but no evidence of harm from diversion of safer supply medications. This is according to the coroners in both British Columbia and Ontario, and there's no increases in youth seeking treatment in British Columbia. So if diversion is a barrier to funding, what scientific published evidence are you relying on, or are they relying on the people that are spreading this information to make these claims?
Thank you for the question. Just to be clear, what the minister described the department doing right now is just really systematically taking stock of the evidence in the situation, but primarily on the ground with the projects that we are funding. So we have not made any determination at this point whether the harms are occurring. We're acknowledging that many have expressed a concern. We're taking the concern seriously. We have responsibilities with respect to the funding that we're providing to the projects which we fund, and we're taking those responsibilities seriously and working with the communities to understand, or the projects to understand, that they have the appropriate safeguards in place. That's okay. Really at the extent of the examination which we're pursuing.
Well, we're hearing from law enforcement that this isn't the issue. They're more worried about toxic, unregulated street drugs that are killing people. And there is obviously disinformation that's being spread. It's, I met with healthcare workers last week, and they were saying that this is causing enormous harm, not just to the clients and their patients, but actually to the people working on the front line of this crisis. What is your government going to do to get the data out and information campaigns about actually what benefits Safe Supply has to their patients and how it's lowering the people that are the amount of deaths and the risks of those people that are using?
Perhaps, with your permission, Dr. Weiss is spearheading a comprehensive study of the project. So maybe, Sam, if you could speak a little bit about that work.
Absolutely. So the Canadian Research Initiative for Substance Misuse is evaluating both Safe Supply in 11 sites across the country. It's in the third year of its examination, and first publications have happened. We're also evaluating the decriminalization or the Section 56 exemption for BC through this arm's length evaluation by the health academies and research hospitals. And I think that the point that the honourable member discusses is critical to all aspects of services that are available and can be available to people who use opioids. That need to be, they need to be alerted to what is available, whether it is harm reduction, whether it's treatment, whether it's recovery. What the data actually shows is that the vast majority of people are not accessing the services that are available. And we don't do a good enough job matching the actual needs with the services that are available, whether that's through a more comprehensive public discussion of what's available through various communication needs. But all of these services are... sorry.
Okay, thank you. Next, Ms. Goodridge, please, for 5 minutes.
Thank you, Mr. Chair, and thank you to everyone for staying behind for this next hour. It's really appreciated. In BC's Safer Supply protocols, it explicitly states that there's no evidence supporting safe supply. In fact, the protocols say there is no evidence, to date, there is no evidence available supporting intervention, safety data, or established best practices for when and how to provide it. In fact, and I quote, "A discussion of the absence of evidence supporting this approach is required for securing informed consent from patients." So where is the evidence if this is what is required in their protocols, the BC's protocols?
Well, I can tell you that there has not been much evidence. Two major publications, of course, appeared in January that have examined, in particular, safe supply in BC specifically. Safer alternatives to toxic illicit drug supply have existed now for about 25 to 30 years.
I appreciate that. You answered it in the first 30 seconds, so that was absolutely wonderful. My next question is, has anyone in the department met with Safe Supply Streaming Company?
Not that I'm aware of.
Have there been any meetings within the department with any stakeholder regarding the legalization of drugs like heroin, cocaine, or meth?
There have been no meetings concerning the legalization of those drugs.
Therefore, the meetings that were held with the previous Minister of Mental Health and Addictions, Carolyn Bennett, with Dolph, there was no conversation at any point with, or Van Du, there was no conversation at any point during those meetings about further legalization with their compassion clubs? At no point they brought that up in any part of those meetings?
So it would be very hard for us to, like, we meet with a lot of stakeholders and some of them raise things with us, but we can say that at the request of the department to pursue that conversation with stakeholders, no. In the context of a discussion with stakeholders, do they raise ideas that they have which may or may not align with government policy?
So does it align with government policy, yes or no?
Could you clarify what you mean
Does
by it?
legalization of substances like cocaine, heroin, methamphetamine, does that align with government policy?
For my response earlier to your colleague, no.
Okay, thank you. I appreciate that. So the question is still, okay, I'm very concerned about the decriminalization and the change in the tone from Minister Bennett now to Minister Sachs regarding that there would be measures taken to stop or change decriminalization if measures weren't being met. Now it's, well, we have to do everything we possibly can because this is a crisis well beyond our control, and not even looking at the fact that perhaps this is causing it. Are there any specific metrics that could be tabled with this committee as to what the public health and public safety metrics are for decriminalization?
So the study which Dr. Weiss referred to earlier, there's a systematic study of decriminalization, a 3-year study with very, very clear indicators and metrics that are meant to inform effectively the answer to the question that you're asking about successes, risks, and benefits of the initiative. At the time of issuing the exemption, the government was very clear in saying, we want to learn as much as we can from this experience, and we'd be prepared to act and adjust in response to the information that would be provided. To my knowledge, that's still the policy.
So are there any hard metrics? Like if it goes beyond this many deaths, the answer is no? Yes, Mr. Weiss.
So the study that's being referred to will be looking at the public health impacts of decriminalization on people who use drugs. We'll be looking at the criminal justice impacts. We'll be looking at decriminalization policy to the general public, looking at the impact on the health service system itself.
If you could table that with the committee, that would be great. We don't have tons of time. So my next question is, have there been discussions to change the policy officially from the Government of Canada in regards to decriminalization across the country?
Not to my knowledge.
Have public servants actively discussed with ministers potential changes to the current policy?
Of, like, for the BC exemption?
Yes.
Well, in the context of their request to us last summer, where they asked for certain amendments, there were absolutely many discussions with the minister.
They made any requests to the government of BC considering that it is an abject failure?
BC has a requirement to provide us with regular reporting as to with various metrics to the status of their, and so we routinely brief the minister on the data that's being provided to us.
Has the Government of Canada made any specific requests of BC?
Okay, that's your time. Go ahead and answer the question, and then we're going to move on.
There's a letter of requirements posted on our website which enumerates a number of requests that we made of the British Columbia government in the context of this exemption. That's maybe the best answer I can provide.
Thank you. Next, Dr. Pawlowski for 5 minutes, please.
Yeah, I don't know if we can say BC's a failure, at least not yet. But we've heard so much talk about evidence today, and I think, and it was Mr. Weiss said something about being no evidence, but rather than going into evidence for exactly what, I did want to look at one of the pieces of evidence which Gord John cited, which was, and the Globe and Mail talked about, was the BMJ article that came out in January, which certainly seemed to look, at least initially looking at it, there's pretty good support for the fact that safe supply seems to work. Now, the study did find that safe supply dispensations of 1 day or more were associated with reduced all-cause mortality. I won't give you the numbers. In overdose-related mortality. Furthermore, if it was dispensed more than 4 times, there was an even further decrease in mortality. But that's not a randomized control trial, right? That's a cohort study. So I started thinking about it and looking, well, who's your cohort? Because you're comparing this group of people who give safe supply, with another group of people who don't get safe supply. And you're saying, okay, those with safe supply are less likely to die from overdose and die overall. But when you make up that study, that cohort which is not getting it, and where do you get those people's names from? Well, one of the sources, I kind of looked it up, and it was the discharge abstract database. So these are people who are being discharged from the hospital with a diagnosis of they've been admitted because of an overdose, right? They've done it before. They've done it to the degree that they've actually had to been hospitalized for it. So perhaps this is a sicker group, a group that's more likely to overdose beforehand. So when you're comparing the two groups, then of course, those who have a higher risk are going to, in the study, show up to have died more, either from overdose or everything else. And in addition, I looked at their study limitations. One of the limitations was they said perhaps some of the people we put in the safe supply category were actually getting narcotics because they had cancer or something else, which just kind of really puzzled me. Like, why? How could you leave that? So I'm not sure about how good data this is about the benefits. It also doesn't calculate any costs due to diversion and the diversion on the street. So and then what other evidence is? I looked at the CMAJ article out of London, and that seemed to be looking more at decreased infections with safe supply, which is a different issue. And then last of all, with the BMJ study, it came to the rather interesting conclusion that safe supply dispensation did not significantly modify the odds, the odds of all-cause or overdose-related acute care visits. So people who got the safe supply were just as likely to have to go to the emergency room or something with an overdose, but okay, they didn't die, but maybe that's because they were on narcotics, because as a lot of people know, that if you don't take narcotics, you lose the tolerance for it. So those who get safe supply are on it all the time. They're tolerant. If they overdose, they're less likely to die. Anyhow, I wanted to ask you all about the evidence from the BMJ study. How good is it? And lastly, and I want to put this in case I get cut off because I run out of time, could you please provide this panel what evidence there is in terms of the scientific research about safety and benefits?
All right, that was a question with a 4-minute preamble. You have a minute.
A minute. Okay, thank you. Well, I'll say that the publication is a very good publication. It's not outstanding. It's a retrospective study and needs a lot more work in this area, and more work is being conducted by this group. I think the evidence that is emerging from the study by CRISM on the 11 safe supply sites suggests that safe supply is beneficial to highly marginalized patients, assuming they also receive integrated services alongside the safer supply. The evidence there is actually quite strong. It's already been published, but it's qualitative in nature. I think that we are at a point now where safe supply, coupled with opioid agonist therapy, coupled with psychosocial services as a collective, reaching people where they are has a much greater chance of keeping them alive and keeping them out of emergency rooms by not having safe supply, by not having integrated services. So the evidence is growing, but it's...
Sorry, can I cut you off there? Because I'm not so much interested, okay, collectively these work, but I'm interested in safe supply per se. Or if you could give us the reference to the paper that you say is going to show benefits.
Yeah. Thank you.
That publication, there have been very few studies that have focused exclusively on safe supply without other variables included, and that was indeed one of the problems with this study, because the numbers of variables, in particular for marginalized patients, are exceedingly high and not always documented as part of a research study.
Thank you, Dr. Weiss. Dr. Kitchen, please, for 5 minutes.
Mr. Chair, I appreciate that, and thank you for being here. Appreciate it. So what I've heard from you is that the minister and the government comes up with the policy, and you don't have any input into that policy, and then you just implement the policy. Is that correct?
No, we certainly provide advice to the minister.
Okay, so you provide advice, but do you direct the advice to the minister?
We provide advice to the minister.
So you provide advice based on what you've heard or based on what the minister's told you to hear?
So the government sets the policy direction, and then we execute on it. So the advice is informed by many things. It is informed by extensive outreach to interested parties, stakeholders, across a gamut. It's other governments and a number of things.
So have you ever advised the minister to change policy?
Yes.
Have you advised the minister to consider changing the policy as we have it right now?
Which policy are you referring to?
Dealing with the opioids and safe use.
So, to use as an example, the drug strategy, which the minister referred to in her comments, was the product of work done by the department in order to sort of shape and give substance and form to the policy direction that the government itself set. So that would be an example where.
Okay, so you haven't advised them to change policy. So the next question then comes to the reality is you've indicated to us that that there's never been a discussion on legalizing other drugs. Is that correct?
Well, no discussion that I've been part of.
Thank you. So Minister Bennett stated in March of 2023, and I'll just quote, Minister Bennett of Mental Health and Addictions basically stated, "We have to move to a safer supply of drugs, like we have done with alcohol and cannabis." So the policy from the government is to move to a safer supply of drugs, yet you've never put forward that policy, and yet you've never discussed that policy with the minister.
Sure, yeah.
In terms of policy discussions, and I think if I'm understanding correctly, it's with reference to prescribed alternatives, or what you've been referring to as safer supply. There have been a range of discussions in terms of prescribed alternatives and how to support people through a harm reduction measure as well as through treatment. So we've been looking at...
The question was about what the minister has stated, which is safer supply of drugs, whether that might be supply of cocaine, etc. And you've said you've never had that discussion. The minister has clearly stated in the House that that is where the policy is. So are you advising them for it, or are you advising them against it?
So thank you for the question. I mean, the policy and the program around the prescribed alternatives or safer supply, as it's referred to sometimes, the policy that exists and it's well documented on the Health Canada website is the one that we advised the minister on. But
you indicated to me that you would advise the minister against things as well. But it doesn't sound like that's the case.
We, as a normal course of public service and giving advice to the government, we will provide a range of options for, against, big, small, fast, slow. And so in the context of executing on the Safer Supply initiative, we would have provided all sorts of advice on the manner in which the initiative should be rolled out.
Thank you. Have you advised the minister on basically supplying alcohol and cannabis in retail stores?
We provided the government much advice on how to legalize and regulate cannabis, yes.
And there was the advice being in favor of that, and is it therefore going to concur with other drugs?
In the case of cannabis, the government had a policy that they wanted to move to regulate and legalize. The advice that we provided was how to do that.
Okay, thank you.
Dr. Kitchen. Thank you, Mr. Costin. Next, Dr. Hanley, please, for 5 minutes.
Yeah, thank you very much. I'm pleased to have the opportunity to ask a few more questions. I wanted to make 2 quick points about diversion. One is maybe to state the obvious, but diversion has been around as long as prescription of drugs has been around. And a well-run safe supply, providing drugs to people legally, obviously, when people are not doing well or are not candidates for opioid substitution therapy, has been shown to have extensive benefits. And yeah, the more evidence on that we can gather, the better. What I do want to say, though, when I was lucky to travel to the downtown east side just at the beginning of last week, actually, with my colleague, Mr. Johns, we were told at one of the sites, the politicization of the safe supply, the rhetoric and politicization of conversation around safe supply is literally killing people. And please, can we talk about the evidence and evidence-based policies and not let politics get in the way of saving people's lives? So I just wanted to put that on the record. Dr. Tam, you haven't had a chance to speak yet. You may be relieved, but I'd certainly like to give you a chance to give a few perspectives in a couple of minutes that I have left. Look, I know this is hugely complex. We have 22 Canadians now on average dying per day, which means collectively as a country we're not doing enough to address this epidemic. And as CPHO of the country, what do you see as the main challenges in addressing this crisis? And I have a couple more questions after that. So,
I think the data or the facts about this crisis shows that right now it is the extremely toxic illegal supply that is causing the most harm. So I think that's just one fact that everyone should bear in mind, and therefore some of the application of the range of measures is because of that. So right now, I work very closely with my colleagues, the other chief medical officers of health, and we stood up at the Special Advisory Committee, as we did with the pandemic of COVID-19, collectively to try and support in whatever way we can to address this crisis. And it's complicated, but I think what we saw through data was that this crisis evolved over time. When we started in 2016, fentanyl had appeared, but it didn't swamp the whole supply. Right now, 84% of all apparent opioid-related deaths are because of this extreme toxicity. So I think, and that is not necessarily the case, say, in another country like Portugal, which, of course, has many great practices that we can sort of examine. And so I think we worked really closely to get the data. People talked about the data. And you've seen some of the BC data and the BC coroner's data. You can certainly follow up with her. But the people who are dying from this crisis are not dying from a prescribed drug that they could find in there as they did their examination. It is primarily, vast majority, the toxic opioid drugs. But I think, as the minister said, there is no simple solution to this very complex issue. It's a whole of society, whole of government response across all pillars from prevention to recovery, of course, treatment and harm reduction.
Thank you. You mentioned the Special Advisory Committee. Is that still in action? Is it still active?
Yes, and we support, of course, an overarching federal, provincial, territorial committee that's looking at mental health and substance use or addiction. Our focus absolutely is to try and get that data. And the Public Health Agency continues to even put public health officers inside jurisdiction to support the coroners and medical examiners to get as much detail as we can. When we started, there was very little capacity. Now we can at least give some ongoing quarterly updates.
Thank you. And there may not be time for much of an answer, but in 2018, you wrote a report on youth and substance use. I know this is an area you're quite passionate about. You talk about the complex interplay of risk factors, but also the protective factors of youth. In 5 years, has anything changed in your point of view about the importance of youth and prevention?
I think prevention is perhaps one area that everybody would agree on. and I think is agnostic of the type of substance. Youth will access psychoactive substances, a whole range of them, from alcohol to cannabis to, indeed, potentially opioids. And so I think the root cause of some of the reason why youth enter this epidemic has to be addressed. What I'm really happy about in terms of advancement is, for example, Budget 2023 actually has this $20 million for the preventive youth prevention approaches, the Icelandic model. I was actually really happy because a lot of the attention has been on the other components. But if we don't address this cohort of youth will then fall into the epidemic itself.
Thank you, Dr. Tam. Suite Madame Laroche pour 2 minutes et demie, s'il vous plaît.
Merci, Monsieur.
Thank you, Mr. Chairperson. Mr. Custon or others who may wish to respond, you're perhaps not from public safety, but you must provide to the CBSA the tools that it requires to identify and prohibit fentanyl and other toxic substances at the border in a safe and effective manner. Now, I'm wondering, Canadian borders are often as effective as a sieve. Have you been successful in dismantling these networks? And are there fewer illicit drugs crossing the border nowadays?
Merci pour la question. Et...
Thank you for the question. Absolutely. There's a lot of work being done at our borders. In Canada, as Mr. Costin earlier alluded to, but also in collaboration with the United States. Absolutely. Has there been dismantling? Yes, as you've seen in news reports. I don't have specific details to convey to you, but my colleagues from public safety could fill you in. But of course, there is less traffic, but I defer to my colleagues on that matter because I don't have those details at hand. But absolutely, there has been a diminution, and we've received reports stating as much. Well, now, the crisis is different from province to province. In Quebec, there's not really an opioid crisis, but a contaminated drug crisis. Have you been able to identify the discrepancies between Quebec and other provinces in Canada in that regard?
Oui, alors il y a des services de...
Yes, there are drug checking services that are available. Drug analysis is performed. Methamphetamine, cocaine, opioids. So there are specific drug checking tests to determine whether drugs are contaminated and what the differences are between various provinces and territories, especially vis-à-vis Quebec. There are opioids, of course, across Canada, but you're right, there are regional discrepancies that are quite substantial and have a bearing on any action that's taken by the respective provinces and the federal government to boot.
Mr. Johns, next for 2.5 minutes, please.
So we've lost over 42,000 Canadians due to unregulated toxic drugs. In the United States, it's been hundreds of thousands of Americans. We don't need more evidence that toxic street drugs produced by organized crime and profited by organized crime is what's killing people. 30 states in the U.S. doubled in overdoses in 2 years. None of them had safer supply. So that's the evidence that harm reduction actually works, because we know that in BC, deaths have gone up 5%, and Ontario at 6.8%. That's not good enough. We need to ramp up safer supply. In Alberta, where they scaled down harm reduction, no safer supply, no decrim, focus on recovery, absence and criminalization, they're skyrocketing death rate at 18%. In Saskatchewan, similar to Alberta, 32%. In San Fran, they closed their safe consumption site in 2022 for 11 months. 11 months later, their death rate went up 25%. So Alberta has made safe supply prescribing illegal. They will fine doctors who provide life-saving care $10,000 a day for every patient who these doctors provide safe supply to. Alberta is reducing support for and closing safe consumption sites against all scientific evidence. And since Alberta made these ideological decisions, overdose deaths, like I said, have surged 18%. What will this government do to limit the harms of Alberta's ideology-driven policies? And what will this government do to support the people of higher risk of death due to Alberta's policies?
So thank you for the question. Very important question. I'll do my best to answer it. It kind of in some ways goes back to the minister's sort of fundamental position around what the federal strategy is and the work that we're doing with all provinces and territories. And our support and our understanding of the impact of harm reduction services is unequivocal.
We need both.
And
we need both. Harm reduction and treatment and recovery, prevention, education, and decriminalization. All supported by the police, Canadian Association of Police Chiefs.
And from where we sit, that is the government's strategy. A full continuum services through from prevention and harm reduction and treatment and recovery, aftercare supports, the whole continuum. And we do a lot of work directly, as the minister said, in supporting community, as you know, supporting community-level interventions where there aren't otherwise supports, particularly in the harm reduction space. We have supported, and I think the ones that I have in front of me right here are the 39 supervised consumption sites that have seen 4.5 million visits since they were first established 6 or 7 years ago, 52,000 overdoses and no deaths. So we understand fully the impact and the importance of harm reduction in dealing with the very acute end of harms.
Prairie Harm's selling hoodies to keep their doors open.
Yeah, I know.
Thank you both. We have about 2 to 3 minutes left. There's interest on both the next two turns to pose one question before we let you go. So the Conservatives will get a question, the Liberals will get a question, and then we're going to wrap. Go ahead, Ms. Goodrich.
Thank you, Mr. Chair. In a Calgary Herald news article from December 26, 2023, Indigenous leaders in Alberta referred to safe supply as pharmaceutical colonization akin to genocide. What consultations have been done with Indigenous leaders and people in recovery regarding safe supply, specifically with First Nations on reserves? Concise.
So, and I don't mean to sound overly bureaucratic in the response. The way that we support Safer Supply, the Safer Supply projects at the federal level, is an application-based process. So the projects that are being funded right now are those who made applications to us. To date, there aren't sites in Alberta on First Nations communities with respect to on Safer Supply. So the extent
I did not ask in regards to Alberta. I asked in regards to Indigenous and on First Nations.
Okay. Specific to Safer Supply or just generally to the crisis?
Specific to safe supply.
I might have to get back to you on that. We have lots
Please
of
table it with the
conversations with
committee.
Indigenous communities about the crisis, and we talk about all manner of interventions, but I would have to get back to you with whether there's a specific Safer Supply conversation.
Thank you.
Will you table that with the committee?
Yeah, sure.
Thank you. Last question is to Dr. Pawlowski, and he promised to keep it under 4 minutes.
Several of you have mentioned the Iceland model. I too like the Iceland model. Could somebody briefly in layman's terms explain the Iceland model and what Canada is doing or what the government has done to try to institute something similar in Canada? Thanks.
Sure, I'd be happy to take that question. The approach to the Icelandic model very much focused on youth substance use prevention is an approach very complementary to the integrated youth services that Dr. Weiss spoke to. It's an approach that considers the broader social surroundings affecting youth through their school, their peer environment, their communities. So rather than focusing on changing individual behaviors, it really looks at the community and meaningful connection within the community. So through Budget 2023, there was a decision to accord $20.2 million over 5 years. We are moving ahead with that decision by the government through a number of streams of work. The first stream is to develop incubator and capacity building within communities. There was a call for proposals proposals that came back. I'll try to do this in 1 minute. I see your signal. That call for proposals closed on January 15th. Stream 2 will then fund implementation of intervention research following up on those who are successful through Stream 1. And we've also are developing a knowledge development and exchange hub, which will help synthesize the knowledge that's acquired in each of these communities and help exchange across the country.
Zoe, and thank you all for being with us today and for the work that you do on behalf of Canadians. Is it the will of the committee to adjourn the meeting? Yes. We're adjourned. Thank you.